Thanks for joining us, Robin.
Yeah, thanks for having me.
So you are a ICU nurse, a former ICU nurse, a life coach, and the host of the Overwhelmed Nurse podcast, correct?
Yes, yes.
Awesome. You worked pediatric neurosurgery and adult critical care. What would you like to elaborate on in terms of when you realized you had a passion for your current line of work?
Yeah, so my nursing career can best be described as overwhelming. I was radically unprepared. I feel like we all feel this way once we get out of nursing school and we transition into nursing, but I felt radically unprepared um, for professional nursing, despite working in like a magnet facility with this great residency. And it wasn't so much that it was my skill or my competency. It was almost this frustration that all I have time to do is like push medicines. Like I don't have time to do anything else. My first job was an acute inpatient rehab unit at a huge hospital. And so med-surg ratios, 6 to 7 patients at night, but they had like heparin drips and insulin drips and like we're crashing all the time. It was insane. So right away, I was like, this is not safe. There's so many things that are not right here. I want to change this. And I actually started going back to school for my PhD in nursing leadership and research at that time. But I didn't complete that because it just wasn't, I didn't feel as effective as I could be. My pediatric neurosurgery job, I loved. I loved it. There is really magic in finding the right specialty for you, the right population to serve, and having a really supportive team. But still,
Sure.
life kind of caught up with me. And there's just this general trend of like when the stress got really, really high, I was absolutely miserable. I dreaded going to work. And was like the good nurse, but almost the cold, stoic, like miserable nurse. I hate to say that, but that's absolutely kind of what it was like. This all kind of came to a head. Like I hit a breaking point just between life stress. It really wasn't even work stress at the time. It was the life stress that caught up with me. And I went through a lot of change. I did a lot of learning, a lot of growing. And I found coaching during that time. And I'm a certified life coach. And so going through that certification program, you do a lot of self-coaching, you do a lot of peer coaching before you ever coach anyone who is not familiar with coaching. And the transformation that came from that coaching was really impactful. And so I knew, I kind of just committed to the coaching program, not really knowing what I was doing. But through that process, I was like, wow, this is a really great way to make a difference, because it's all about encouraging self-awareness and your internal response, and it's all about the control that you have in your life. So the merging of the life coaching and nursing, I don't know, that just felt natural because I've been a registered nurse for 7 years. I was almost a doctor of nursing. I know, like it's my thing. It's kind of my expertise. And so kind of bringing the life coaching skills to nursing just felt right because we're stressed out.
Yeah. And when we scheduled this Q&A, we had no idea that we would be in the throes of COVID-19, guys. Like this just kind of all just naturally fell into place. I have goosebumps. Like it just felt so like aha whenever we decided that we were going to do this. And then this week came and I was like, oh my gosh, our team, as a nursing community, we're in the throes of this 2020 crisis. And I just want to say right here, blanket statement, that nothing that I say or Robin says is reflective of anything but our own knowledge and our own opinions. We are going to direct you to sources that we find reputable, like the CDC and the WHO organization, the World Health Organization, and that's where you're going to get your most up-to-date COVID information, guys, okay? So if you have questions, please ask. Get your questions in the comments. We'll answer them as we go. And we're just going to learn about how to overcome what we're given on a day-to-day basis at the bedside or in nursing overall. So let's talk about, well, what tips can you give nurses as a community of people?
Absolutely. Absolutely. So the nature of what I do is everything is it's always putting it back into your hands, basically. So it's very easy, especially as we get overwhelmed, to get caught up with, I mean, if we just take it back before we had a global pandemic to deal with, it was very easy to get caught up with, my unit is always short-staffed, I'm always getting pushed back or canceled, I'm working with the not the most supportive team. Like it's very easy to get swept up in these undesirable aspects of your job because they're really difficult. They are really difficult. And so we can very quickly get caught up in those undesirable aspects of my job are the reason that I'm miserable at my job, or the reason that I'm unhappy at my job, or the reason that I don't like this. And while that's definitely a piece of it, there's not much you can do about that. There's really not. You can change settings, you can change facilities, you can change professions, but if you're still responding to stress in the same way, that stress could potentially. Can you hear me?
Yes, I can hear you now. Can you all hear? Those of you that are tuning in, hopefully. Yep, we're switched over. Okay, go ahead.
Okay. But just this idea that, yes, things suck, right? There are going to be things that suck. And now in this time, there's so much that's beyond our control. The resources that we have available to us, the response is changing, the protocols are changing every single hour, it seems like. We don't have that control, right? And so this is the time to really go inward and reflect inward and start observing, like, what do I have control over? And how can I step into that influence? So what can I do to change my response to the circumstances around me, or to the environment that I'm in, or to what I'm facing? And I'll kind of reference the question that was left in the comment. I'm so sorry, I can't remember who it was that had posted that, but it was basically
Kathy.
a story about how these, Kathy, that's right, thank you, about how these rules are inconsistent. Like one place says one thing and one place says another, or a few hours later it's different. And you're absolutely right that this is ridiculous and overwhelming, and it makes our jobs that much more difficult. And it's scary. It's scary because we don't want to infect anyone. We don't want to get infected ourselves. Like, we don't want to make anything worse. But how much control do you have over the input that you're getting and the instructions that you're getting in the dynamic situation? You know what I mean? I think in that situation, it's helpful to ask yourself, what do I need to feel confident and to feel solid in the fact that I'm doing the best that I can in these circumstances? If there's specific things that you can do, like maybe I'll check these updates, or I'll ask for an update every so often, or not, that's fine. But if you ask yourself that, then you'll, what can make you feel like you're doing what you need to do, and that you can let go of the fear of maybe making a mistake, or just something undesirable happening because of this situation where things are just changing all the time and inconsistent. And tips.
I mean, if we're honest,
I just realized
like,
that was
most of our
Sorry, go ahead. Sorry, go ahead.
No, go ahead. Tips. Go ahead.
Okay. So, just in general, in this moment, and with everything going on, I think that it's really important to prioritize your self-care. And when I say self-care, I don't mean relaxing, as opposed to, what I mean is there's so much nervous energy building up all the time that you need to seek stillness, okay? You need to have self-compassion. This is the kind of self-care that I mean, the stuff that is kind of not so obvious. You need to sit with your emotions, all of the uncomfortable emotions. You need to sit with them, and you need to just experience them, let them breathe. If you allow them space, they will leave you because they're just temporary and they're just messages. It's information from our system. And what this will allow you to do is to have awareness of, what am I afraid of? What am I feeling? And what are the thoughts? Because thoughts trigger emotions. So what are the root thoughts underlying these emotions that I have? And once you know what your stress is, you can also start to pick up on the energy that you're receiving from the media, from your coworkers, from your family, from the general public, from the Walmart shelves, because we're sensitive. We're sensitive to that energy from other people that's also stressy, that's also afraid, that's also anxious. And when you're aware of what I'm afraid of and what's causing me stress, then you can more easily, like, consciously let go. You can say, that's not mine. That's my husband's stress, right? Or that's my mother's stress, or that's my coworker's stress. That's not my stress. I don't have to respond or react to that stress because that's not mine. And just give these uncomfortable feelings their moment. And this kind of stuff, if you're not accustomed to doing it, it takes a little practice. It feels a little uncomfortable, but ultimately you will feel better because you're allowing it to leave you. If it doesn't leave you, then you just carry it with you, and it builds up and it builds up and it builds up. And then you can't function because it's too much. So owning what's yours, releasing what isn't yours. And in terms of stress management, thinking of ways to neutralize the impact of the stressors in your environment. So what does that mean? A shortage of PPE is like a huge stressor that we're seeing all the time, that people don't have enough protective equipment, or we're afraid if it runs out. Okay. Walk yourself through an exercise of this situation of, like, what can you do? What can you do to influence the outcome of this situation? Realistically, what can you do? If you can do something, great, do it. If you can't, or if you've done all that you can, then it's time to ask yourself, how do I protect myself from the impact of this stress? Like, what do I need to kind of fortify my heart and to just have faith, or just believe that, things are just going to be the way they are. They're going to be okay, because I have no control over the situation. So it's really examining, what do you have control over? Being brutally honest with yourself, like, I don't have control over this, and it's scary. And that's okay, because it is scary. But then once you arrive at that place, okay, I don't have control, I'm afraid, but what can I do for myself to feel better about this, so that this is not so impactful to me and my wellness, basically. And that kind of segues into really the last big tip that I have. Sorry.
Go ahead.
Which is
our sound is a little off. You guys haven't noticed.
Yeah, it's delayed. Really, just this last kind of leg, or this last kind of tip or whatever is really leaning into your spirituality. I'm not talking about religion specifically. I'm not talking, what I mean by spirituality is what you can connect to feel hope, to feel peace, to feel like even though I am not in control of this situation, there is a greater picture here, and it's going to work out how it's going to work out, and I'm going to be okay regardless. Whatever that looks like to you, it's really just reflecting inward and promoting your own resiliency. That's what I mean by spirituality, is what can you connect to draw upon when you have run out, right? Because there's things that we have limited or no control over. There's things that feel really big and scary. And there's so much unknown. Everything is so uncertain. We have, every single one of us, I think, are just on this precipice of like, what's coming tomorrow? How long is this going to last? What's next? What does this look like? We're all kind of in that boat together. So how can you, and what can you connect to that brings you a sense of safety and a sense of security, or as close to those things as possible, like in the midst of all this? Because really and truly, the best self-care and the best stress management cannot prepare you for these types of feelings of like, I have no control and I have no idea what's going on. And so this spiritual piece is really kind of key here too.
For sure. I think I'm just going to touch on something that you said earlier, because there's been a lot of tension amongst our community as nurses. We all need to be allowed to feel what it is that we're feeling. So if you feel hopeful and I feel angry, it's okay for us to encourage each other in whatever it is that you're feeling and I'm feeling at the same time. Like, I'm angry that we're running out of PPE, and you're hopeful that there's more is going to come and bridge the gap. Like, we can both be there and on the same plane and encourage each other. You guys, you've got to encourage each other. We can't divide right now. We've got to lift each other up. I mean, this is hard. This is really hard, and it's okay for it to be hard. Nursing's never been easy.
Yes, we are neurologically, as human beings. Yes, I do. We are literally wired for community, especially women, not to exclude men, but especially women. We are, as humans, wired for community, and we are not meant to do big things alone. And this actually comes up, I deal with kind of interpersonal conflict and these kinds of issues with clients all the time, because we work in a stressful environment. Because even without a global pandemic, nursing is stressful. Hospitals are stressful. Anyone within the four walls of the healthcare setting is stressed out. The patients are stressed out. The healthcare providers are stressed out. The families everyone is stressed out. What happens when you're stressed? That's literally threat. Your brain is interpreting stress as, I am not safe. This is really important, and it will really help you have compassion for yourself and compassion for others when you see behavior that you just don't really understand. Stress is interpreted as, I am not safe. As soon as your brain is cued to threat, all of your resources go towards your stress response system. So your sympathetic nervous system, your fight, flight, or freeze response. And when those resources are reallocated to those places, you can't communicate as effectively. You can't problem solve as effectively or as creatively. You can't critically. Like, you truly cannot function at your best as your stress burden increases and increases and increases. So my point there is that everyone truly, some people don't believe this when I say it, but it helps to just go with it. Everyone is doing the best they can in the moment. Sometimes our best does not look very good, but that doesn't mean that we're not doing the best that we can in this moment. And regardless of what comes up for you when you hear me say that, because I know, I hear it all the time, but regardless of how you might want to fight that statement, if you do, what if you chose to try that on? Just what if you chose to try it on? If you look at this response that's triggering you, or that's upsetting you, or that you don't support, or that you're unhappy with, how might it change your response to it to believe that they are doing the best they can in this moment, just like you are doing the best you can in this moment? That just kind of helps you get in this space that things aren't necessarily personal, and that it's just a bigger picture, and we need to hold space for each other. We're supporting the nation right now, and we're the only ones to support each other. We've got to come together and support ourselves too. So holding space for each other to be afraid, to be angry, to be frustrated, to be stressed out, and recognizing that we're all really facing at a neurological level the same struggle. It might be because of different factors, but we're all having the same response and being in the same struggle. And we can understand each other more than anyone else can understand what we're going through. So, if you do get upset about something, just maybe take a step back, allow yourself to be angry, but maybe think about what it looks like to respond as opposed to allowing yourself to react.
Yeah, I like that. I think also in the midst of all of this uncertainty, having a plan also helps us that are planners, which I know as nurses, a lot of us tend to be planners, right? So if you're anxious about bringing COVID home to your family, you need a plan. What does that look like to prepare to walk out the door to go to work? What does that look like to come home decontaminated, or have a plan to decontaminate before you contact your family, right? Like having these plans, because we can sit and mull and fester and be angry and anxious and all of those things and be caught up in our thoughts. But what does that do? That doesn't do you any good. That doesn't do any of the people that you're encountering any good. But if you can come up with a plan of action, man, that does something, right? When you say like, I can actively do this. I can't control that the masks are all gone. I can't control that. But what can I control, right? Do you have anything to say about that?
I think that you absolutely hit the nail on the head, and the importance of knowing what you're going to do, like the importance of having a plan and really thinking through these situations that you're afraid of. That I've been recommending, I feel like all day, every day here lately, is this really, really juicy exercise. You just pull out a pen and paper and dump all of your thoughts as soon as they come to your mind about whatever it is that you're overwhelmed or stressed out or anxious about. Just dump them on the paper. I think you should dump until there's none left, but as long as you dump for at least a minute and get all of that stuff on paper, it's out of your head. It's like actually true that if you write the thoughts down, you're pulling them out and you're making space for new thoughts. Next, like, look at what you just wrote. And I say this kind of jokingly and kind of not. Our minds are irrational, emotionally, and fear-driven spaces. That's because they're wired to protect us. They're wired to grasp on to the most negative signs and the subtlest signs of danger that they possibly can. So it's very easy to get stuck in negative cycles, negative thought and feeling cycles. And the feelings are so overwhelming, right? And so the way that we break through this is we have to think greater than the way that we're feeling. And a way to combat this is exactly as you said, with like being able to objectively approach the issue, right? So let the feelings breathe. You have to let the emotions breathe first. So it could be helpful to do some deep breathing, do a little meditation, do some exercise, something that puts you kind of in a more calm, more still, more resourced, and not so emotionally charged space. Look at your situation. You can be the most objective at that time. When you dump all these thoughts out, then you can very easily identify what is a fact. Like, what are the absolute facts of this situation? Like the facts that would hold up in court. No one can deny that this is true about this situation. Identify the facts. Then go back and identify the thoughts and the feelings. And every single time, especially when it's kind of like a catastrophic, overwhelming, negative kind of situation, every single time, I promise you, you will realize that your mind is really multiplying the fear, the anxiety, the discomfort, the noise. And this allows you to be like, okay, it's really not as bad as it feels like it is. And then from that place, start walking through your scenarios and coming up with your plan on how you're going to keep your family from being exposed to the stuff that you wear. Whatever it is that you're trying to figure out, like, then you can walk through it. You're more resourced, you're more objective about it, and you're less likely to spiral into that like fear cloud. So really, we're all there, and it's very easy. It's easy to do, but these are some ways to approach these issues, because we have to do something about them. We can't just hide from them. But doing so in a way where you feel safer and you feel more resourced and you feel like ready, kind of, or more equipped to get a plan in place.
Yeah, all great input. And also, as a community of nurses, you have those that are working in the front lines and you have those that are not. And I think we all need to be hyper aware of the fact that everyone's emotions on either side of those areas of nursing at the moment, I guess, they're different, right? You have different emotions going on amongst the two different areas, if you're a frontline worker or you're not. And I think we really need to be able to hear everybody that's on the opposite side of things and hear and work together and just support each other. Guys, this is hard. And I hear you and I understand that it's hard, and I'm getting teary-eyed. Like, this is hard and I hate it. But I think Robin's got some great insight for us. She has some great support for us. If you search her name in the Tribarian group, she's always got great insight. So if you're struggling with something, search her name, and she might have spoken on it already. I know she's available to be reached out to. Reach out to her. Those of you that are watching, if you have questions, get them in before we end here. But Robin, I want to know, like, do you have anything to add before we move on?
I don't think so.
Okay. So let me look to make sure I didn't miss anything. What are you looking forward to most on a career focus? What are you looking forward to most as in your position?
That's a good question. And what I am looking forward to most is really stepping into being a thought leader in nursing, into being a change agent in nursing. I believe that quality and safe patient care evolve naturally from nurses who are happy, healthy, and well. So if there was more of an emphasis on taking care of our frontline staff, of really just taking care of everybody, if we were all more heart-driven and connection-driven, and I don't mean specifically us at the bedside, I mean like the system. I mean like the healthcare system. As opposed to how to save money, as opposed to like resource maximization. I really believe the shift needs to be on the wellness, the health and the wellness of the people who are supporting the system. And if you have people who are working and supporting the system who are healthy and who are happy and who are well, then you're not going to have to, I will never forget being told in a shift huddle one day that the theme of the month was compassion. And let me tell you how to be compassionate. And I was angry and insulted because I'm a nurse. I became a nurse because I'm compassionate. You don't need to tell me how to be compassionate. You need to fix all these things that are in my way for really being able to be compassionate and connecting with my patients. And so what I do is, it's right now it's on a one-on-one. I'm supporting individual nurses in their mental health and their mental wellness through, that good self-care and the good stress management, and bringing their spirituality into their stress response. But my vision is to start, I'll just say it, to start a movement that begins with the frontline staff, because there's so many of us that if we wanted things to change, we could change it, but we have to be unified and we have to be resourced, and we're not resourced when we're overwhelmed. So the first step is supporting our nurses and being resourced and being well. And then driving change in our practice areas that are good for the nurses and good for the patients and good for the facility, that are good all around, because they're coming from the people who are actively working in it and delivering the care. So you're going to know what's best. You're just going to know what's best. I really think that one of the biggest problems is we are so overwhelmed and we are burning out, that we're just surviving, that most of us are just surviving, as opposed to showing up connected to our calling and ready and equipped to handle whatever stress we encounter, and also actively generating, new ideas and new ways to drive change in our settings to change the system. Big goal.
Well, a student nurse just checked in. What advice do you have as students sit back and watch all of this, feeling helpless, I'm sure, frustrated that they can't go to class, frustrated that their curriculum is now all online, and they're thinking, I'm not an online learner, I don't know how I'm going to do this. What advice do you have for them in overcoming the overwhelm of nursing school?
I love that question. Such a great question. Thanks for asking it. So this is my opinion, and I'm kind of being humorous when I say it. You're going to feel like you aren't prepared, regardless of whether you get that clinical FaceTime or you're online or it's online learning. I say that to hopefully allow you to have a breath of relief that these unprecedented changes to your education, it's not fair and it's not ideal and it's very scary, but you are going to be okay. I know this hands down 1,000%. I don't need to know anything else. Every single one of you. So what do you need to do so that you believe that you're going to be okay regardless? Okay. So much of our job as a nurse, they really should call us universal problem solvers. I'll never forget when I first transitioned into nursing, I was like, I am solving everybody's problems all day long, and nobody ever taught me what to do when chocolate milk starts oozing through an old J-tube site, okay? Just you'll see the craziest things. And it'll be difficult, but it's not going to break you. It's just challenging, okay? So breathe. That's my first advice. Breathe. Big, deep belly breaths. Breathe. Let your feelings have some space, okay? It's okay to be afraid. It's okay to be disappointed. It's okay to feel helpless. Everyone, whether you're a student or a nurse, no matter what your position is, your feelings, when you feel them, are validated every single time. Your body does not lie to you, okay? we don't do a good enough job validating our feelings with ourselves or with other people. But your feelings are information from your system about the situation that you're in. Okay, so no matter what you're feeling, it is validated. Now, there are, I think, better responses to those feelings. You know, there are like better responses and maybe not so good responses, but the feelings are totally justified. Let them breathe. And then examine your situation. What can you do? What can you do to better facilitate this new learning environment, to better support you in this new learning environment? How can you take care of yourself so that you're releasing this stress and this frustration so that when you go to study, you're all in, ready to study, as opposed to the mind is turning, this sucks, oh, I can't do this, I can't do this. Those thoughts don't serve you. When you start to feel overwhelmed, observe that. I am feeling overwhelmed. Why? What's the thought? What's the root thought? My mouth is so dry, I'm so sorry. What's the root thought? I will give you a hint. The root thought to negative feelings is always an I am thought. Every single time, you guys, it's our minds doubting ourselves, doubting our ability, being afraid that we won't be successful, being afraid that something bad will happen to us. That is what triggers negative emotions, okay? So get the root of that thought, and then is that thought serving you? No, it's not, because it's making you feel bad. What do you need to think to feel confident, to feel prepared, to feel resilient, to feel like I can do this? What do you need to think to stimulate those feelings so that you, right? The thoughts that I can't do this, that's not serving you, okay? So what thought do you need to think to feel like you can do this, that then allows you to study in a way that helps you to be successful? Okay, it's basically, I mean, it kind of comes back down to this idea of what can you control versus what you can't control. You can't control your learning environment. You can't control the timeline of things. You can't control what this virus is going to do or what your first job is going to look like. Like, there's a lot of things you can't predict, you can't control, you can't rely on. But what you can rely on are the thoughts you think to trigger the feelings you want to feel, to do the things you want to do, to work towards the outcome that you would like, okay? And know that when you start doing this, you are absolutely overriding your body's default patterns. So a lot of it, like if you're feeling anxious and overwhelmed, that's because you kind of have a default response in these types of situations to go to that place. That's okay, but it's important to realize that your body's going to fight you in your attempts to feel better, okay? Because it's literally knocking it kind of out of whack a little bit. So just know that you have to consciously think stronger than the way that you feel, which means I'm feeling really bad right now. I know it's related to this root thought. I'm going to choose to consciously think this thought despite how bad I feel, in order to kind of override this and start literally rewiring like more supportive responses. And when I say more supportive responses, I mean responses that default to, you've got this. In any situation, you've got this. Everything you need. You're totally capable right now and in the moment. Another little hack, literally all of our grief, all of our frustration, all of everything negative is related to some root thought that we doubt our ability to be successful or to make it through or to essentially be able to achieve, what we want or the outcome that we want.
So I'm going to ask you like a truly applicable question, because I want to know, like, I've always been a ball of stress and anxiety like my whole life. And so for me, I learned that if I said, okay, I struggling with labeling the nerves, which was one of my big things in nursing school. Like labeling the nerves in the cadaver lab almost broke me. I knew I didn't have the resources and the knowledge to do it myself. Like I was at a loss. I didn't know what to do. But what I found is if I could find the resource, then I had the tools. So whether that was my study group, whether that was the TA, whether that was the professor, whoever that was, that I could get the resources, right? Like I don't have everything I need, but if you know where to find it, then you have a stepping stone and you have somewhere to go. So either the resources or a plan. Those are my two coping mechanisms.
That was a really good clarification, because what I meant, because you're absolutely right. Like sometimes you truly don't know the answer, like but somebody else does. But you know that you have the ability to seek the information elsewhere. So even though you may not be equipped in that moment to handle it, you're absolutely right. You can find the support to get you through that. And on that note, I want to just add this last little bit, because it's for student nurses and for brand new nurses or new-ish nurses a few years into your practice. This comes up all the time. You will seek support and you will not get warm, fuzzy responses sometimes, whether that's from whoever. It doesn't matter who it's from. It's like reality that you will seek support and the response that you get will not feel good. One, this response is not about you. Okay? It's not a reflection of nursing competency or your success in the nursing profession. That's the first thing. The next thing is, again, everyone's doing the best they can in the moment, and that person just responded to you out of their own stress. It's not fair and it doesn't make it right, but that's just reality, okay? And the third thing, don't be discouraged. Don't let it discourage you. Keep asking, even if it's the same person or if it's the same resources. Do not give up just because you're let down by or uncomfortable with or hurt even by the response that you receive. That sucks. In a perfect world, we would all be uplifting each other and we wouldn't be talking about this probably, but that's not it. That's okay. But
yeah,
but you will be successful if you just keep going. Okay. Don't let any kind of response you get stifle your fire.
Absolutely. Hey, Robin, I really appreciate our time together. We are running over our time limit. Sorry, guys. Those of you that are still watching, we've gotten lots of feedback. Robin, I didn't interrupt you to let you know because of the sound discrepancy. Lots of people are saying thank you and they appreciate what you had to say. Students, no matter where you're at getting your education right now, you will never be prepared when you walk across the stage. You will walk into your first day of your real nursing job thinking, I didn't learn any of this. You're fine, okay? None of us did. We learned so much in school, but it's all fine-tuned and really applicable on the job. You're going to be fine. We're all fine. You're going to be okay. And you guys that are going to be teaching these new nurses as they come out receiving a different education than any of us ever did, remember that you need to have compassion. These students didn't want this. They didn't ask for this. They didn't want to sit behind a TV screen when that's not their method of learning. Be compassionate with them. This is going to be a new wave, and I know you guys are going to come out better than you ever have before. So Robin, thanks for tuning in. I'm getting all emotional here. Have a wonderful day. And you guys support each other. Thank you so much for everything you guys are all doing. Be well. Take care. And tune in to the podcast. I almost forgot to tell them about the podcast. I already mentioned it, but I do want to tell you that I'm going to be on the Overwhelmed Nurse podcast. So tune in. I'll let you guys know when Robin's going to play that series. I don't know. that show. I don't know. Anyways, Robin's going to interview me on the Overwhelm Nurse podcast. You guys tune in and subscribe to her podcast. All right. Have a great day.